Sometimes in nursing, you have to have informed consent for invasive procedures. So today we're just going to show you the different types of informed consent and the nurse's role with it.
To give informed consent, a patient must be fully informed of the procedure. The benefits versus the risks must be explained, and consent must be voluntary. A patient will be provided with the names and qualifications of medical personnel completing the procedure, and the patient has the right to refuse the procedure. Two forms of informed consent can be either expressed or implied consent. First, let's watch implied and then expressed.
This is implied consent.
Come in.
Hi, Ms. Jones. My name is Nicole. I'm going to be your nurse today. How you doing?
I'm good.
Okay, the doctor ordered you to get a shot. I need to get it into one of your arms.
Here we see the patient lifting her sleeve. That's implied consent. Now listen to the dialogue to hear expressed consent.
Is that okay?
Sure.
Thank you.
Consent can be expressed directly, orally, or it can be written. A patient can verbally state yes or no. Yes, I will allow the procedure, or no, I would like to try alternative therapies or medications first. Now let's explore emergency consent. Sometimes, patients are not in an able condition to make their wishes known, and the delay of any procedure could result in loss of limb or life. That's when emergency consent comes into play. Let's watch the wrong way to do it first, and then the right way.
This is the wrong way to explain emergency consent to a patient. Sega, it's very hard. Wake up.
What?
We had to cut your arm off.
Why?
Because otherwise you were going to die. You were in a bad car accident. We had to cut it off. I'm just letting you know. Just giving you a heads up.
What? I didn't give any consent.
Well, you were going to die, so we had to cut it off. I mean, that's just how it is. This is the correct way to explain emergency consent to a patient. Just pretty sorry. Can you wake up? Are you okay? How are you feeling?
I'm good.
Okay,
Thanks.
I just want to let you know, you don't have a right arm. You were in a very bad car accident, and we had to remove it, otherwise you were going to die. How does that make you feel?
No, I'm just kind of dumbfounded, I guess.
Okay, well, I'm here to answer any questions that you have. I'm about to go grab the doctor, and we're going to talk to you a little bit about it.
That's much better. Also important is the role of the nurse. The nurse must validate the identity of the person signing the consent form, and if the patient has any further questions after the consent form has been signed, the nurse must contact the physician to come back and explain the procedure to the patient. Let's watch as a nurse explains this to a student nurse.
Okay, I see that our patient is scheduled to go down for surgery today. He came in with a broken hip, and he signed his consent forms yesterday for the surgery. Can you tell me exactly what the nurse's role is pertaining to these forms?
Yeah, all the nurse needs to do is go into the room and talk to the patient about the consent forms and make sure that when the physician came to talk to that patient about surgery. All she has to do is witness that the physician gave consent to the correct person.
Okay, thank you.
No problem.
We hope that this video has been informative. Thank you for watching.